Hi everyone. I did my presentation on ADP inhibitors, which is a class of antiplatelet medications, and these medications affect blood coagulation. For those of you who would like an overview on normal platelet activation and factors that control clot formation, please review this slide. There are 4 classes of antiplatelet medication, and these include ADP inhibitors, COX inhibitors, phosphodiesterase inhibitors, and glycoprotein 2b/3a inhibitors. This presentation will focus on ADP inhibitors, in particular clopidogrel or Plavix. Other medications in this class include pastrogel and ticlopidine. These medications work by inhibiting ADP-dependent pathways of platelet activation. Clopidogrel, or Plavix, is recommended to be used as an alternative to aspirin for the treatment of recent MI, stroke, established peripheral artery disease, and coronary artery disease. Plavix is a prodrug, which means it is in an inactive form until it is administered. Normal metabolic processes turn the drug into its active form, where it works to prevent platelet aggregation by preventing the binding of ADP to its platelet receptors. This prolongs bleeding time, and the effects are irreversible. Plavix and the other medications in this class have a pregnancy category B rating. Plavix is used to inhibit blood clots in coronary artery disease, peripheral vascular disease, and with cerebrovascular accidents, and is used to prevent myocardial infarction. As you can see, Plavix has multiple drug interactions, mostly with medications that can affect bleeding and blood clotting. It is advised not to use Plavix with other anticoagulants or NSAIDs without prior approval from your physician. Also, when used with proton pump inhibitors such as Nexium and Protonix, the absorption effects of Plavix the absorption is reduced, and these medications should not be used together. The same rules apply for herbal supplements and vitamins. These medications on this list interfere with bleeding and blood coagulation and should not be used in conjunction with Plavix unless otherwise approved by your physician. Adverse effects associated with Plavix are extensive. However, the most common are headache, dizziness, diarrhea, chest pain, and flu-like symptoms. Severe adverse reactions include severe neutropenia, thrombotic thrombocytopenic purpura, acute liver failure, hypotension, and hepatitis. Contraindications to use of Plavix include known allergy, known bleeding disorders which increase the risk of bleeding, recent surgery which increase the risk of bleeding from the surgery site, and closed head injury which increase the risk for bleeding from the injured vessels within the brain. Nursing considerations that you may have for a patient taking Plavix include the following. Nursing diagnosis may include risk for injury related to bleeding effects or central nervous system effects, acute pain related to gastrointestinal or central nervous effects, and deficit knowledge relating to drug therapy. Patient assessment you would want to include is to carefully monitor your patient and report signs and symptoms of GI bleeding, especially when taking aspirin or NSAIDs. Lab tests that need to be monitored are platelet count and lipid profile, and you want to evaluate patients with unexplained fever or infection for myelotoxicity. Education that you want to include for the patient and family include that they need to report any unusual bleeding, such as black tarry stools or vomiting blood. They want to avoid chronic use of aspirin or NSAIDs, again, unless otherwise approved by the physician. And if the patient is breastfeeding, not to take this medication while breastfeeding because it does enter the breast milk and it can affect the child. Pharmacokinetics associated with this medication include the absorption. It's rapidly absorbed in the GI tract. Its onset is 2 hours and it reaches its stable state within 3 to 7 days. Distributed 94 to 98%, it's protein bound. Its metabolism, it's rapidly hydrolyzed in the blood to its active metabolite. Elimination, it's 50% is excreted in the urine and the other 50% is excreted in feces, and it has a half-life of 8 hours. Peer review of Plavix. A study was done of 401 patients, and it showed that this medication, Plavix, was not either metabolized or absorbed depending on two genetic variances. Patients that were a carrier of the CYP2C192 gene were not able to metabolize Plavix effectively, and carriers of the ABCB1C3435T gene were not able to effectively absorb Plavix. Another study done in 2009 indicated the effectiveness of Plavix was greatly reduced if patients were taking the medications ketoconazole, itraconazole, voriconazole, fluconazole, and omeprazole, in addition to the other medications on this list. So again, these medications should not be taken unless otherwise approved by the physician. This is the reference list, and this concludes our presentation for today. Thank you.